So when I'm talking about adjuvant chemotherapy with the patients, we talk about the fact that depending on the stage of the patient, they are likely already cured from the surgery alone. And again, depending on the stage, we'll talk about the numbers being anywhere from 30 to 40% chance of being cured for the stage 3 patients, up to 60, 70% for the stage 1 patients and in between. And obviously there are many variables that go into that for the individual. And I tell them that if we were to give the adjuvant chemotherapy, that their likelihood of being cured is going to be improved by 5 to 10%. And meaning that there will still be patients who go through the chemotherapy and are not cured. And that number will again vary by stage and other factors that we don't really know how to look at yet. That by giving the treatment, some patients will be cured who would not otherwise, but the majority who are cured even without the chemo, and kind of go from there. Most patients have at least some familiarity with gambling, and so we sort of look at it in that context. If they're having a hard time, we'll talk about 100 patients here and 100 patients there, and 5 to 10 more being alive in the group that got the chemo versus the one that didn't. It really depends on the sophistication level of the patient as to how we go through that discussion.